Nurses and other healthcare workers have been on the front lines since the start of the pandemic.
Many say they are still facing challenges like fighting for better benefits and protections, all while battling a deadly virus. News 8's LaMonica Peters talked with healthcare workers and one institution working to get more people trained in healthcare.
United Nurses Association says that about 43,000 healthcare workers across the country have gotten sick after treating COVID-19 patients. Now they're still raising their voices about the stress, working conditions, and being paid fairly.
There are times when I'll walk onto a unit and a nurse just grabs me and cries and is in tears from being overworked and not being able to be there for their patients as they want to be.
The United Nurses Associations of California says more than 70% of its members surveyed reported experiencing anxiety and burnout. Nearly half were currently suffering from insomnia and depression. More than half said they lacked the mental health support they needed to cope with working during the pandemic.
We have sacrificed so much. We've worked tirelessly, overtime shifts, double time shifts, missing your meals and breaks to give the patients the care that they deserve. You're missing time out with your family.
Amid the public health crisis, hospitals across the country had to find ways to relieve overworked staff. Medical assistants were retrained and called in from clinics and medical offices to help out.
I believe there is a staffing shortage, not just generally, but also in medical assisting. And the American Association of Medical Assistants is trying to provide resources to train medical assistants or to retrain them or to upskill them in some of these other responsibilities.
Staffing shortages and burnout aren't the only issues they say they're facing. 21,000 healthcare workers in Southern California employed by Kaiser Permanente voted to officially strike on November 15th. But 2 days before the strike, the union and Kaiser came to a tentative agreement that guarantees wage increases across the board until 2025.
Over time, it would be hard to retain and recruit nurses that would stay and be committed to providing patient care to members and patients in the community that are Kaiser members.
After the strike was authorized, Kaiser Permanente released a statement saying they'd offered a 4% a year pay increase with no reduction to benefits or retirement. They say their goal is to slow the already over-market growth in pay as healthcare costs rise. Even as healthcare workers fight for what they believe they deserve, the University of San Diego says it's seen an increase in nursing program applications during the pandemic.
COVID has also played a role in that, where some of the nurses are taking early retirement, they're tired. However, the nursing schools are still graduating and accepting many applicants. The pandemic has actually ignited a lot of interest in nursing and the profession.
Cassidy Creek says right now there are about 450 students enrolled across all programs. She says as the pandemic subsides and hospitals get back to pre-pandemic routines, they're ready to help increase the number of people trained to work in healthcare.
The hospitals drive that number for us. We are open and excited to have as many students as we can possibly educate in the best way possible. But at the end of the day, it's the safety of the patients and, of course, our students.
Nurses and healthcare workers with Palomar Health are also on the picket lines. They say they're concerned about staff shortages, outsourcing, and patient safety. I'm LaMonica Peters, News 8.